when it comes to face masks for people of all ages?
Yeah, so broadly speaking, the general guidance that we're getting at is that when you're out in public, it's advisable to wear a face mask. Beyond that, we're looking at other scenarios, which might be more when we're in a school or when we're in a closed, confined space. So the optimal thing here is that first and foremost, maintaining social distance is the most effective thing. We like to overlay on top of that wearing a face mask when out in public or when you're in spaces where you're interacting with a lot of people. Face masks are also recommended when you're in a space where maintaining that social distance from others is really difficult and you can anticipate coming in closer contact with others.
One question I received from some people, and I hear this a lot on social media, people wondering, are face masks safe? Some people wonder if you're breathing in recycled air. I see comments like that where people wonder, is it really safe for me to be wearing one for an extended period?
Absolutely. So for the vast majority of our population, wearing a face mask is completely safe. We've got healthcare providers, we've got folks in nursing homes that are wearing masks almost the entirety of the day. And when I say folks in nursing homes, I mean the residents in the nursing homes. There are groups of people where wearing a mask makes it difficult for them to breathe. And that is a clear indicator. If you have difficulty breathing when wearing a mask, we don't want you wearing a mask. Most of the people that have underlying health conditions that drive them to have difficulty breathing when they have a mask on are also going to be in that high risk category for COVID. So those are also people that we want to try to find ways to distance them from others and keep them away from large groups if we can while COVID is still out in the community.
You mentioned you have kids of a range of ages. So I see the question come up of, is this really going to work? Are kids going to be able to effectively wear face masks? One question I thought was interesting was, if you have a young child who's constantly fidgeting and touching a face mask, is that actually counterproductive because then they're touching their face more? So what is the thought when it comes to kids and face masks?
Yeah, absolutely. So the guidance that the US CDC has put out is that 2 years old and younger, don't try to put a mask on them. It's not worth it. And 3 years and older. And I will be the first to admit, when that guidance came out, I was a huge skeptic. We do a lot of research on using masks in healthcare with highly trained staff. And in that environment, it's pretty difficult. It's a high risk environment. We're wearing different types of masks that really have to be used precision. So I'll admit, I was a mass skeptic of putting a mask on my 4-year-old, but she's proved me wrong with very limited coaching and practice in going out into public with me. The first couple times where we had to orient her to the mask and talk to her about not touching it. And I'll tell you what, she's better at it than some of my older kids now. She seems to have picked it up and adopted it really quick. We also have a number of daycares in our community that have never closed. They were up for first responders and they implemented masks for 3 years and older. And they've reported really high rates of success in getting kids to wear masks and getting used to it and being able to wear them for long durations.
So maybe that's part of it, of if you have a child, making sure a mask fits correctly is probably important. What should someone know if they're trying to get a mask for their kid? What should they be paying attention to?
Absolutely. So this is going to be, I think, for the next year, this is going to be the new kind of learning how to tie your shoes for kids of all ages. So a few things that are important is you want to have a mask that will cover your mouth and your nose, and that by and large will stay covering your mouth and nose as you talk and as you kind of, spend time throughout the day. A couple things that we've learned, the more snug the mask fits around your face, the more effective it is at capturing anything that you might be exhaling or putting out in the environment for others to be exposed to. The other things, there's kind of two other things to look for, aside from a good snug fit around the nose and mouth, is material that is multiple layers. So you can have a single layered mask. There's videos on YouTube on how to cut up a t-shirt and make a mask. Those are kind of at the lower range of effectiveness. If you can find a cloth face covering that has multiple layers, of fabric. Those have shown to be more effective. And then the next consideration is if you can find a fabric that is water resistant, still breathable, but resists water, that's where we start getting into a protection factor from what is out in circulating from others, where you have fabric on your face that actually doesn't absorb liquid as it comes into contact, it repels it.
In your opinion, a lot of schools are saying masks will either be required or recommended. In your opinion, what do you think schools should be doing with masks? And then what other steps? You had mentioned social distancing. What is the best guidance for schools moving forward that are going to invite kids into their school?
Yeah, absolutely. So my opinion is that masks, until we have a vaccine, we need to require masks for kids to come back to school in person. Until we have widespread immunity in our population that can shut down transmission of this disease, that's a necessity, not only to protect kids and teachers, but to protect others in our community. We're going to go from a Tuesday of having no mass gatherings in our community for Omaha to a Wednesday where we've got 2,000 kids gathering every day in a high school. So it's an important layer of protection. In terms of other things that are important to consider for schools, again, finding ways to social distance, and what we're talking about at really critical time points, yes, in the classroom during teaching, arrival and dismissal, and for sure eating. So that is the trick, is how do we accommodate students to eat in a manner that's safe and we're not undermining all the other protections that we've put in place throughout the day. So we have schools across the state that can come back to school at full capacity and adequately social distance. The capacity of those buildings, we're not at that on a regular basis. We have other schools that we're going to have to come up with strategies to have fewer students in the building on a given day to make sure we can adequately distance them out. The other things that are really important is just finding opportunities and key time points to wash your hands. And perhaps the most important thing, Jennifer, is if someone in your household is sick, or if your student is sick, to keep them home. They may be in a low risk category and we're not super concerned about them being admitted to the hospital or having a really poor outcome, but we've got a lot of dedicated teachers and administrators and bus drivers that are high risk, and they're doing everything they can to keep these kids educated and socially active. And so it's really important for the next year that as we have kids that are sick, we're taking those measures to keep them home.
That is one thing that comes up a lot. People saying, kids are a low risk group, and really we don't even know if kids are transmitting it to other people. What do you tell people when they say they're not sure about whether asymptomatic people can give it to others? What is the thought on that?
Yeah, so I mean, really clear evidence that asymptomatic folks account for about 50% of infections. And that's a complicated thing to say. So let me make sure we're being clear. So the way that we're referring to that in the scientific literature and in the medical community is pre-symptomatic. So we may have someone that ends up getting sick, but the area where it appears they are most apt to infect others are those days before they show symptoms. We also have others that remain asymptomatic and have the ability to spread the virus to others. What there's uncertainty about, but a lot of focus and a lot of effort going in to try to solve, is how does that equate for kids? And what we're talking about for kids is not just one big broad category for children. We've got we've preschool, elementary, and high school. And physiologically, these are different, human beings. So really trying to parse out what is at play, what is the risk in those different levels of age groups. And we're still learning a lot. We've only known this virus for 6 months. We're working as fast as we can to solve these things. There have been some reports as of late of summer camps opening up, having a lot of cases and shutting down in the US. So we're really interested in finding out more data and information about what are those cases? Is that the staff? Is that the children? What's at play? So a lot of focus right now on those dynamics, but we're a lot left to learn.
Is that a concern too? I hear that among parents of, I'm going to send my kids to school, and then in a matter of days, weeks, or months, we'll see some cases popping up and they're all going to come home. Is that something that we have to maybe, if we want to, prepare our minds for a possibility?
We absolutely have to prepare for that possibility. And I think what a number of schools in Omaha have done a really remarkable job of is preparing for, everybody wants to come back to school as normal. And we are all familiar with the experience last spring of a complete closure. So what's really important is planning for that space in between, because there's a strong likelihood that depending on the level of coronavirus transmission in the community, or if we start to see cases pop up in schools, that we're going to need to move to enhanced precautions and new measures. I think everybody's committed to trying to facilitate in-person learning as safe as we can, as much as we can. We're really trying to help schools across Nebraska, especially in Omaha, plan for that middle space where it's going to be complicated and it's going to be ever changing. Yeah, and as a parent myself, having the uncertainty is almost the worst part because it's hard to plan your work day, it's hard to plan childcare. So trying to find things that everybody can understand. If this is happening, this is what I need to prepare for, and communicating those to everybody, I think helps us all kind of trust the process a little bit more.
I received a question on social media, kind of a personal question for you, but as a parent, as a father, do you feel comfortable sending your kids to school in fall?
Yeah, so that changes by the week. To be perfectly honest, Jennifer, and this is something I talk about with my infectious disease colleagues at UNMC quite regularly. It's, as I said, it's going to depend on two factors. The first factor is what is the disease experience that we're having in Nebraska or in Omaha this fall? Have things gotten worse or have things gotten better? And what are the safety precautions that are put in place in schools? For me personally, I really want to see, until we have a vaccine, I want to have a lot of confidence that we've got all the safety measures possible for our children going back to school. Again, because this is a virus we've only known for 6 months, it seems like every time we make great strides in learning something, new information comes out that we have to consider. So for me personally, that is a week by week thing that we're keeping an eye on. Is the transmission in Omaha getting better or worse? And do we have adequate precautions in the schools?